Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey and let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, coworkers, and everyone you know to listen to the show, available on podcast apps worldwide. If you have a question or an idea for a future program, share your idea with me by commenting on my social media posts on Facebook, Twitter, YouTube, and LinkedIn. You can also complete my caregiver survey or request a consultation by going to my website, PamelaDWilson.com, clicking on the Contact Me button, and completing a form. Welcome to this episode of the Caring Generation podcast in the Take 15 series. Helpful tips and insights in 15 minutes. How caregivers can be more effective in working with medical providers. I'll share insights into the experiences of caregivers who provide support to aging parents, grandparents, spouses, and others through coordination with doctors in the healthcare system. We'll talk about reasons care coordination can be complicated and how to make coordinating care easier. Let's start with the idea of care coordination and what it means. Care coordination can also be called care or case management. In families, this role usually falls on the primary caregiver who knows the most about the person who needs care. So working with medical providers involves care coordination. The healthcare system prefers to use the word patient for this person. Care coordinators or care managers in healthcare systems might be known by the title of nurse, social worker, discharge planner, care coordinator, care manager, or care navigator. There's also a term called chronic care coordination or coordinator that relates to care for Medicare patients. This is a Medicare benefit that offers 20 minutes a month of care coordination services outside of an in-person office visit, plus other benefits that may be helpful. I'll include a flyer in this week's podcast transcript, so be sure to ask about this benefit. The greater number of health conditions a loved one has means more involvement with and working with more medical providers. For example, a parent who has a heart condition, depression, arthritis, and COPD may see a cardiologist, a psychiatrist or psychologist, a rheumatologist, a pulmonologist, in addition to a primary care physician or a geriatrician. This gap in awareness between multiple physicians can be dangerous if all specialists are prescribing medication and treating health concerns, and there's no one in the middle sharing information. The concern is that the family caregiver or the patient, due to a lack of experience working with medical providers, may not know they should be coordinating care, informing, or asking questions. Additionally, a care coordinator or care manager's role is to make sure the entire care team, this is another medical term that means everyone medically and socially involved, that the entire care team should be updated. There are circumstances when the clinical or medical side of healthcare does not realize that there may be community-based organizations or social care involved. How is it that healthcare providers lack awareness of involvement by other providers? Here's one example. A caregiver or a patient may work with an organization that provides transportation to medical appointments. So when a doctor says to a patient, "I want to see you in 3 weeks," the patient or their caregiver has to contact the transportation company to set up the appointment. And the transportation company in some cases may not be 100% reliable, so sometimes that patient may be late or miss an appointment. If the doctor's office doesn't know that a transportation company is used, They may view the patient as someone who makes appointments and then doesn't show up, not knowing that this person has to rely on a transportation service. So for a family caregiver, working with medical providers means identifying people on the care team, including transportation companies, and making sure everyone knows who is involved. Let's now talk about frustrations experienced by caregivers and patients for a moment so that you can see how all of this comes together and identify the potential problems before they happen, or the frustrations before they happen. When working with medical providers, it's important to understand the role of care team members and their motivations. Frustrations experienced by caregivers and patients include accessing services, long wait times for appointments or treatments, poor communication, no communication, delayed communication, a general lack of understanding about a care plan, incorrect information provided, and too many people involved. A care plan is another medical term for the process a physician or health care provider uses to create specific conditions. Care plans are also used by home care service companies. For example, a healthcare company sends a physical, speech, or occupational therapist to the home of a patient who is discharged from the hospital to encourage walking and physical recovery after hip surgery. In all places where care is received or provided, including the home, there's an expectation of patient participation. Working with an increasing number of medical providers can be intimidating for patients and caregivers, especially if it's unclear of who is responsible for following through and how this happens. Imagine having 5 physicians giving a patient instructions. No one making sure that the physicians are working with and communicating with each other. Most of the time, this responsibility falls on the family caregiver or the patient themselves. However, even when the caregiver tries to encourage communication, there can still be gaps. These gaps occur if physicians are not on the same electronic health record system. They can't share information. So working with medical providers may require extra effort from patients and caregivers, like printing documents and providing them to a number of medical offices. The use of electronic health records and health portals can add difficulty for older adults who may not be computer savvy or want to communicate via electronic methods. While virtual appointments can be a plus, learning how to use the platforms can be initially challenging. All the more reason to have another person, like a family caregiver, to assist or be involved in the process. While electronic health records, the health system calls these by another acronym, EHR, Emily, Harry, Robert. They can be beneficial, they can also be problematic if inaccurate information exists in the record and no one is willing to take responsibility for correcting it. This can be a huge frustration of caregivers and patients. For example, electronic health record systems may have information about appointments, treatments, or tests that are due by a certain date. There are times when the dates for vaccinations or procedures are entered automatically and are wrong. So there may be a date for a mammogram or another type of screening that the patient has already completed or for some reason is not yet quite due. If no one manually checks and updates these records, the record can make it appear that the patient is overdue or not following through with recommended care. That's called being non-compliant. Inaccurate records can be problematic if the primary care physician's office or no one else but the patient and caregiver keep track of this information. When working with medical providers, it's important to ask who can or will update this information. As the patient and the caregiver, it's also very important to make sure that medication and supplement lists that include vitamins are up to date, because there can be negative interactions between medications, vitamins, and supplements. It's okay to ask, are you the person responsible for helping me with care coordination? Or are you the person who can help update my medical records or help me schedule tests? Caregivers and patients may find themselves working with more than one care manager or care coordinator, so it is very important to ask these questions and realize that the healthcare system works in what they call silos. You can think of a silo as a type of a business. A primary care office can be a silo, a nursing home, another silo, home health care, pharmacies, other silos. In addition to being different types of businesses, their electronic medical record systems may be different and they may not be connected. This means that Dr. A and Dr. B and Pharmacy C and Home Health Care Company D have no way of automatically viewing or sharing your information across computer systems. When working with medical providers, you might get tired of answering the same questions and providing the same information. This sharing is called interoperability. That's another complicated healthcare term. Healthcare sharing or interoperability has been a work in progress in the healthcare system for years, and there's still a lot of work to be done before all involved can share records. So, as a patient, as a caregiver, making sure your records are accurate is up to you. So here are some examples. Silos also exist because providers are paid based on different goals. For example, if you're in the hospital, a hospital discharge planner is motivated by discharging patients to a rehab center, nursing home, or to a private home. The second motivation of hospital discharge planners is to avoid patients returning within 30 days to the hospital. Because if patients return under some conditions, hospitals can be financially penalized. So, hospital discharge planners are motivated to avoid financial penalties. So, instead, they transfer care responsibilities to the rehab center, nursing home, or to the patient and their caregiver. If patients return home, it's very important that the patient see their primary care physician within a few days of discharge. So what can happen is the hospital discharge planner or someone from the doctor's primary care office, especially if they are part of the same hospital system that can suffer financial penalties. They may call you the day after you return home to ask if you have scheduled your primary care physician appointment or to help you schedule the appointment. You may be thinking, why do I want to go see the doctor when I've just spent 5 days in the hospital and 10 days in the nursing home? Well, here's why. Your primary care physician is also financially incentivized to stop you from returning to the hospital. So as you can see, everyone involved in providing healthcare has a different area of focus, which is why the term silo is often used. The reason for the post-hospitalization doctor appointment is to make sure your medical records are accurate. Your primary care doctor didn't come see you in the hospital. The hospital doctors were doing what they thought were best. They didn't communicate back with your primary care physician. So as a caregiver or a patient, the best thing you can do is to learn who is involved in your care, who is the best person to help you with each specific needs, how to get the information you need, how to provide the information the care providers need, and how to keep your records accurate. If there's any confusion on any of these points, don't hesitate to ask. If one specialist recommends something and it contradicts another specialist, ask them to talk with each other. For example, one doctor may want a particular blood test while you know another doctor wants a different test, and maybe you've already had the test done. You can work with medical providers to save time and multiple appointments by coordinating all of this. You can gather all those orders for the blood work and take them to a single location where the blood is drawn. Another quick example of why advocacy is important is, let's say your loved one has back pain, but the medications have side effects they don't like. So the medications make them tired, dizzy, or nauseated. They decide not to take the medications. The next time they go to the doctor's like, how's the pain? They're like, oh, I stopped taking those pills. That is not a solution. When working with medical providers, be persistent in communicating anything that does not go as planned. Communicate through healthcare portals so the information and the requests are permanently in your record. It's up to you to make sure that you and your loved ones receive the care they deserve, especially as care needs increase. It doesn't get easier, it gets more complicated. Use care managers and care coordinators to help you as much as possible so that you can get the help you need, avoid burnout and exhaustion. I thank you all for being here. Please check out the over 180 episodes of the Caring Generation podcast and share this episode and all the episodes with everyone you know so that we can extend the support, education, and love that so many caregivers and the persons who receive care need. I'm Pamela D Wilson, a caregiving expert. You're with me on the Caring Generation. I look forward to being with you again soon. God bless you all, sending love and light to everyone. Sleep well tonight. Have a fabulous day tomorrow, and enjoy each day until we are here together again.
Tune in each week for the Caring Generation with host Pamela D Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D Wilson's The Caring Generation.